Hello everyone, in this video we study about hyperthyroidism. Hyperthyroidism is a condition in which thyroid hormone level and function start increasing in body. Okay, first of all we do a quick review for physiology or function of thyroid hormone. Thyroid hormone function is it increase body temperature, it increase body metabolism and it increase body growth by specific mechanism. Okay, first of all look here, thyroid hormone increase body metabolism by increasing sodium potassium ATPase production. When sodium potassium ATPase production increase, it will utilize oxygen and increase body metabolism. Okay, with that it also increase body other function by increasing sympathetic nervous system effect on body. These are main function of thyroid hormone. Okay, come to hypothyroidism. First of all, we study about causes of hyperthyroidism. Hyperthyroidism can cause by grave disease, which is a disease which is in which autoantibodies produce against thyroid stimulating hormone receptors, and they start activating thyroid stimulating hormone receptors. And in this way, they will increase production of thyroid hormone in our body. With that, the second most common cause is multinodular goiter. Multinodular goiter is a condition in which follicular hyperplasia of thyroid glands will occur. In this way, thyroid hormones start increasing in our body. And then pituitary adenoma is also a less common cause, in which due to pituitary gland adenoma or pituitary gland tumor, thyroid stimulating hormones start increasing, which will start increased stimulation of thyroid production, which will lead to increased thyroid hormone in our body. These are the most common cause which we know about thyroid hyperthyroidism. Then come to its clinical features or symptoms. What will the symptom be if a patient present with hyperthyroidism? We will symptom will divide according to the system or according to organ. First of all, we see what will affect occur on respiratory and cardiovascular system. Okay, thyroid hormone increase expression of beta adrenergic receptors on heart muscle cells. When beta adrenergic receptors expression increase, it will increase the contractility of heart, which will lead to increase heart rate. With increased heart rate, there will increase cardiac output. Okay, this affect on heart. Then with increased heart rate and increased cardiac output and increased metabolism of body, which will lead to increased demand of oxygen. When oxygen demand increase, there will increase breathing rate, which we call tachypnea. Okay, this effect occur on respiratory and cardiovascular system. Then come to GIT. What effect occur on GIT when thyroid hormone increase in our body? First of all, we know that thyroid hormone increase body metabolism. When body metabolism start increase, then what happen? Then patient present with weight loss, and due to increased body metabolism, appetite of patient also increase. But this appetite can't increase the weight of body because metabolism is too high, which increase the breakdown of fats and any proteins and muscles, which will lead to weight loss. Okay, then thyroid hormone increase the GI motility. When GI motility increase, then diarrhea occur in patient, and with that malabsorption also occur in that patients. Okay, then come to CNS. What effect will occur on CNS? CNS effect occur due to increased effect of sympathetic nervous system. As we know that thyroid hormone increase the effect of sympathetic nervous system in body. In CNS, when sympathetic nervous system effect increase, this will lead to anxiety and insomnia, which we call difficulty in falling asleep, and heightened emotions and tremors occur in patient. Okay, then come to eyes. On eyes, symptoms also appear due to sympathetic nervous system effect, because on upper eyelid there is a muscle present which we call levator palpebral muscle. On upper eyelid is a muscle present which we call levator muscle. This muscle function is uplift the eyelid, upper eyelid. This muscle is innervated by sympathetic nervous system. When sympathetic nervous system effect increase, this effect on upper eyelid will increase, and it increase the uplifting of upper eyelid. When uplifting of upper eyelid will increase, which will lead to lid lag. Lid lag is a term in which uplifting of uplifting of upper eyelid occur. Uplifting of upper eyelid occur. When uplifting of upper eyelid occur, with that patient have difficulty to meet up both eyelids, upper and lower, which will come out as appearance of patient as straining gaze. Okay, straining gaze and lid lag is both are clinical feature which we see in the patient of hyperthyroidism. Then next come to the bone. What effect will occur on bone? Higher function of thyroid hormone leads to increased osteoclastic activity on body. When osteoclast activity increase in the body, then what happened? Bone resorption of process increase. When bone resorption process increase, which leads to osteoporotic bones or osteoporosis in patient, and it can also lead to hypercalcemia, because on bone resorption, excess of calcium or bunch of calcium released from bones. Okay, come to muscles. As you know, thyroid hormone also have catabolic effect on muscles protein, and it leads to increased breakdown of proteins. This will lead to decreased muscle mass and decreased muscle strength, which leads to muscle weakness. Then come to temperature. As there is increased metabolism in body, due to increased metabolism in body, patient temperature will more higher, and patient present with heat intolerance and increased sweating, which is compensatory to reduce the temperature. Okay, then patient also present with hyperglycemia. Why? Look, as we know, thyroid hormone function is that it increases the glucose in our body by increasing gluconeogenesis and increasing glycogenolysis, by forming new glucose and breaking the glycogen, which is a storage form of glucose. When hyperthyroidism occurs, this effect will enhance or exacerbate. When this effect will exacerbate, this will lead to a severe increase in glucose in our body. This we call hyperglycemia. Okay. The next feature is patient present with hypocholesterolemia. Higher level of thyroid hormone, which leads to increased migration of LDL into, when LDL level decrease in our blood and migrate to liver, this will lead to hypocholesterolemia. Okay, and with that, a female patient also present with oligomenorrhea. Oligomenorrhea is a condition in which infrequent menstruation occur in female. It occurs because thyroid hormone, increase in thyroid hormone leads to disturbance in other hormone level. It will disturb the other hormone level. It will disturb the gonadotropin releasing hormone, gonadotropin from our pituitary glands, which will lead to FSH and LH. With that estrogen, it disturbs these hormones. Okay, if this hormone disturbed, then patient present with oligomenorrhea or infrequent menstrual bleeding. Okay, these are the all symptoms which appear in hyperthyroidism patient. Okay, come to diagnose. We can diagnose it by medical history and physical examination. We will check all these symptoms in this patient, if this patient have or not, and then we can go to another test, thyroid function test, in which we check thyroid stimulating hormone level in body, T3, T4, thyroid hormone in blood. This we can check. With that, we can also check thyroid antibody test. Is there any antibody present? Or we can also do imaging test to see any abnormality or any tumor in thyroid hormone which increase thyroid production. Okay, these are the basic treatment. These are basic diagnosis which we can do to diagnose any hyperthyroidism patient. Okay, come to treatment. Treatment we can do antithyroid medications. Antithyroid medication is a temporary medication which suppress the production of thyroid hormone from thyroid. Then we can also do radioactive iodine therapy. In this, by iodine radiation destroy the cancer cells, and we can treat this and at the last we can do thyroidectomy. In this we remove the thyroid gland, and we remove the thyroid gland if no treatment is suitable. Okay, this is all about hyperthyroidism. I hope this was helpful for you. If you find it helpful, then please do like and subscribe. Thank you for your attention.